The dangers of Lyme disease. Lyme disease is a zoonotic disease, something naturally transmissible from animals to humans. It is spread by black-legged ticks carrying the Borrelia burgdorferi bacteria. To transmit Lyme disease, it is hypothesized that the ticks must bite and attach to a host for at least 36 to 48 hours. After infection, about 70 to 80% of people develop the characteristic erythema migrans, or EM rash, which looks like a swollen lesion with a red ring around it, more commonly referred to as the bullseye rash. But because of different skin tones, it's harder to see the EM rash, making Lyme disease harder to diagnose. Other symptoms include fever, headaches, and muscle and joint pain, known as Lyme arthritis. While treatable with antibiotics such as doxycycline, amoxicillin, and cetirizine acetyl, if left untreated, other more fatal symptoms might arise. 1 in 10 Lyme disease patients report a persistence of symptoms for months to years after diagnosis and have unsuccessful further treatments.
Advanced and persistent symptoms highlight the harsh reality that Lyme disease is difficult to treat and diagnose. The CDC recommends a 2-step system to check for Lyme disease antibodies, but the results of this test are observed visually, causing Lyme disease to be misdiagnosed. Additionally, testing is hugely reliant on the progression of the disease, which is not efficient for treatment. Antibody results can be incomplete, causing false positives or negatives, and in the weeks it takes for antibodies to develop, treatment has not begun and a window of time has been lost. Lyme disease is also difficult to treat, mainly for people who continue to experience Lyme arthritis, fatigue, and neurological symptoms after initial treatment. This is because certain Borrelia burgdorferi bacteria cells have developed an adaptation to resist antibiotics. These adapted bacteria cells have the ability to go dormant and change their shape and protein content so antibiotics cannot kill them. This allows these bacteria to survive and then reform to their normal shape once the antibiotics are gone, allowing the symptoms of Lyme disease to persist for months to years after. Lyme disease is an unfortunate disease to contract due to testing and treatment difficulties. And while new testing methods are being developed, it is important to take precautionary methods when frequenting an area with significant deer tick populations, like using bug spray.